Welcome to Joint School at Portneuf Medical Center. We're excited that you chose our hospital for your joint replacement surgery. Here at Portneuf, we are dedicated to world-class care, every patient, every time. We believe strongly in returning you to independent living and helping you improve your quality of life. This video was designed to help you prepare for joint replacement surgery. We believe that the better educated you are regarding your surgery, the more empowered you will be in making your surgery and recovery a success. This video consists of 4 video segments. In each video, you will meet a case manager, a nurse, a physical therapist, and an occupational therapist. You will learn what you can do best to help prepare for surgery, what to expect during your stay at Portneuf, as well as tips and tricks to have the best possible outcomes during your recovery. Studies have shown that the more informed patient will have better outcomes, including lower risk of surgical site infection and readmission. With that in mind, please feel free to refer back to these videos as much as you need to help you feel prepared. Again, we are excited that you're here, and we hope that this class will help ease your mind, answer your questions, and help you begin your journey to a better quality of life. Thank you for choosing Portneuf Medical Center. First, we're going to hear from Sandy, our RN case manager. She's going to talk to us about case management needs, including how to prepare for your surgery and insurance needs. Let's get started.
Hi, my name's Sandy. I'm from Case Management. I will be doing the case management portion of this video series. I've been with Portneuf for about 2 years now, and it's my job to make sure that you ultimately have a safe discharge plan and that you transition through your stay here smoothly. Having a total joint replacement is a big investment, and it requires a little bit of work on your part. So first, let's talk about insurance. It's very important that you know if you have been authorized for this surgery. All commercial and Medicare Advantage programs need to make sure there's a pre-authorization. You can either contact your surgeon's office to make sure that was done, or you can contact your insurance agency directly to see if it was pre-authorized. Medicare does not require pre-authorization for having a total joint replacement. Our ultimate goal is for you to go home safely, and if you are able to go home the same day of surgery, that would be the preferred way of going. However, we understand that there are circumstances, and if you do not feel safe on going home on the same day, please let us know and we can see what we can arrange. So we need to prepare for your discharging home from your surgery. The first thing that we're going to need to know is who will be driving you home. After surgery, you'll be on medications that prohibit you from driving. So that is something that needs to be arranged ahead of time. We also would like to know who is going to assist you at home. We prefer that someone remain with you once you get home for the next 24 to 48 hours. I'm happy to have you call if you are unable to find someone to help you go home or who will assist you. If you give me a call, we can work on different solutions. My contact information is below. Before surgery, we're going to need to know what equipment that you have available for your use. We require everyone who is having a hip or knee replacement to have a front-wheeled walker. Most insurances will cover a portion of this. You'll have to check with your insurance company to see what your deductible may be. Medicare covers 80%. The walker usually costs around $80. If you have a secondary along with your Medicare, it should cover the rest of your cost for the walker. Other equipment will be discussed later in our video. Our surgeons like to send you home with home health. Basically, home health involves a nurse coming to check you medically to make sure everything is doing well. If you end up with questions, something doesn't feel right, it looks different, feels different, that nurse would be the first person that you would call to troubleshoot as to what steps to do next. It also has physical therapy that will come to your home 2 to 3 times a week. This lasts usually between 2 and 3 weeks depending upon necessity. you must be considered homebound in order to qualify for this service. Basically, that means it's very difficult to come get out of the house and do things. You're able to, it's just not fun in those first couple of weeks. Below these videos, you'll find a link where you can download the provider lists. You are free to choose whomever you like. Some physicians or surgeons will say they have preferred providers. You are welcome to use those preferred providers, or you can choose another. Please make sure that your home health agency is in network. That would be for those people who have anything other than Medicare. I will need to know this information at the latest the day of surgery so that we can arrange it for you. You do not need to arrange it. There's not a need for you to have home health at this point. So a home health agency will not be able to even get you started. Once I know who you're going to have after your surgery is done, I send all the needed information for the home health agency. They usually will contact you within 24 to 48 hours after discharge, and they will make an appointment to come see you in your home. This is our preferred method of discharge, is going home with home health. There are times that a skilled nursing facility is necessary. At a skilled nursing home, there you'll have a nurse for about 24 hours a day if needed, and therapy will work with you 1 to 2 times a day. Medicare requires a 3 midnight qualifying stay in order to utilize the skilled nursing benefit. And that means you must be in the hospital with an actual medical need, not just staying because it's more convenient. Other insurance requires pre-authorization. All placement in skilled nursing depends upon insurance authorization and whether the facility has a bed available. To recap, your homework is to assess what equipment that you have at home already, front wheel walker, a shower chair, whatever equipment you have that you might be able to use. If you need us to obtain a front wheel walker for you, you will have to let us know who to order the equipment from. There are 3 that will deliver here to the hospital. They are Moggs, Norco, and Snell's. The next thing you'll need to do is choose a home health agency. The last thing is, just in case, I would like you to choose a skilled nursing facility. There are 3 here in Pocatello. They are Gateway, Monte Vista, and Quinn Meadows. If you have this information, your discharge will be much smoother. Overall, case management wants you to have a safe discharge plan. We will need all the information that we have just discussed on the day of surgery. I will either speak with you before surgery at the pre-anesthesia testing clinic or during pre-op. Sometimes I'll catch you during recovery, and other times I will meet you up at the floor. So please have this information all ready for when we come to visit you. Thank you for watching the case management portion of this video.